Hello, my name is Anne. I'm a doctor of nursing practice in Philadelphia, Pennsylvania. I completed my training at the University of Pittsburgh, followed by Thomas Jefferson University, and I've stayed in Philadelphia ever since. I'm originally from Central Pennsylvania, and so here I am in the big city. In my free time, I enjoy running and spending time with my family and friends and my wonderful little boy named Luca. I've been working with Cysview for approximately 12 years, much more hands-on for the past 10 years. And when we first started using it, there certainly were some roadblocks. So some things to consider when you're starting up are that you need time to get the patients ready. And it does take some work in the whole scheme of things to get everyone on board, especially when they're not really familiar with the process, or also when they're not really familiar with the really wonderful impact that using Cysview can have on both the institution and also on the patients. So getting everyone on board is number one. Making the process more streamlined is actually really, really important as well. So one thing to consider is who's going to get the installation ready. Here we have our pharmacy do it. So we had a few meetings with pharmacy to get them on board, and then also with how to order the installation and with what timeline we needed it, and then also who's going to instill it. So we had our residents do it at first, and ultimately we decided that our hospital-based nurse practitioners were the best ones to instill it. And we actually have them instill it either in the preoperative holding area or in the area where they're held before they even get down to preoperative holding. We call it the same-day procedure unit. And so in either of those locations, they're not holding up the rest of the operating room patients or the flow of the operating room. As allied health professionals, it's really important to let the patient know what your role is in the process. So I think as nurse practitioners, physician assistants, or nurses, we serve a really vital role when we educate patients. So we can take the time to tell patients exactly what the purpose is, exactly what they're going to experience, and then take them stepwise through the process. As the nurse practitioner or physician assistant who may be helping with the process as well, you may be required to provide the installation or to actually administer the installation. And it's very simple. It's actually almost the same as giving a treatment for bladder cancer, like instilling BCG. So the catheter is placed via sterile technique, and then the agent is instilled. It's really simple and really only takes a matter of just a few moments. There will be several health professionals who will be talking to the patient during the utilization of Cysview. So initially it's going to be the nurse practitioner, physician assistant, or the surgeon who are going to be explaining the process to the patient, walking them through it, telling them step by step what's going to take place. But also the surgical scheduler. They're actually in another very vital role to help with education of the patient. Again, to reiterate that it's really not much different than a normal cystoscopy. Other than that, it's simply taking a second look. It's, to me, I say to patients, it's kind of like an insurance policy. We're taking a second look because when we look in your bladder, we're looking at the bladder under white light, or just like the lights in the house, just like the white lights in this exam room. And so when we flip to blue light, again, it's a second look. So anything that took up the agent is going to turn hot pink. And so if the surgeon didn't see anything on the initial white light look, again, it's a second look or an insurance policy. And patients usually really feel more comfortable when we explain it that way. We've had many patients in our practice who've been sent from outside providers who cannot offer Cysview, or who've been existing patients of ours who, when we've used the Cysview procedure, we were able to identify lesions that were not identified under white light. And in some cases, of course, this is certainly life-saving or certainly changing the disease process because you're catching it at an earlier point. Certainly, I am very fond of Cysview. Back, I have to say, about 14 years ago, my own father presented with gross hematuria, which I knew certainly was not a good sign. And my first initial thought was that my dad had bladder cancer. And as it turned out, he did. He had superficial bladder cancer. He underwent induction BCG, and thank God he responded really well. And on his repeat resection, we did use a Cysview procedure on him. And here he is coming and having his annual cystoscopies in our practice, and he's doing remarkably well. So I am eternally grateful that my dad was able to undergo a Cysview procedure. Patients oftentimes have a lot of questions about it. Common one is, does it turn my urine blue? No, it doesn't. Really no major side effects outside of a normal cystoscopy. So that's really important for the patient to know. Other than we may see something that wasn't identified under white light. So clearly I've laid out why my practice is a strong believer in the use of Cysview, and certainly myself personally is a huge believer in Cysview procedures. It does take a while to get up to speed with it and to get things streamlined. Here it took us about a year, but I think with proper support and getting everyone on board, I think you can do it in a much shorter period of time than this.
Cysview is an optical imaging agent indicated for use in the cystoscopic detection of carcinoma of the bladder, including carcinoma in situ, CIS, among patients suspected or known to have lesions on the basis of a prior cystoscopy, or in patients undergoing surveillance cystoscopy for carcinoma of the bladder. Cysview is used with the Karl Storz D-Lite C photodynamic diagnostic PDD system to perform blue light cystoscopy, BLC, as an adjunct to white light cystoscopy. Cysview is not a replacement for random bladder biopsies or other procedures used in the detection of bladder cancer. Anaphylactoid shock, hypersensitivity reactions, bladder pain, cystitis, and abnormal urinalysis have been reported after administration of Cysview. The most common adverse reactions seen in clinical trials were bladder spasm, dysuria, hematuria, and bladder pain. Cysview should not be used in patients with porphyria, gross hematuria, or with known hypersensitivity to hexaminolevulinate or any derivative of aminolevulinic acid. Cysview may fail to detect some malignant lesions. False positive fluorescence may occur due to inflammation, cystoscopic trauma, scar tissue, previous bladder biopsy, and recent BCG therapy or intravesical chemotherapy. No specific drug interaction studies have been performed. Safety and effectiveness have not been established in pediatric patients. There are no available data on Cysview use in pregnant women. Adequate reproductive and developmental toxicity studies in animals have not been performed. Systemic absorption following administration of Cysview is expected to be minimal. There are no data on the presence of hexaminolevulinate in human or animal milk, the effects on a breastfed infant, or the effects on milk production. The development and health benefits of breastfeeding should be considered along with the mother's clinical need for Cysview and any potential adverse effects on the breastfed infant from Cysview or from the underlying maternal condition. Cysview is approved for use with the Karl Storz D-Lite C photodynamic diagnostic PDD system. For system setup and general information for the safe use of the PDD system, please refer to the Karl Storz instruction manuals for each of the components. Prior to Cysview administration, read the full prescribing information and follow the preparation and reconstitution instructions.